Hey Pete, so you've been with Align Neuropathy for about 3 weeks now.
That's correct, yes.
Okay, so you've had neuropathy for a while and seen specialists and your family
Yes,
doctors.
that's correct.
What were you told about your prognosis with your neuropathy from your medical doctors?
My medical doctors told me flat out there's nothing you could do. One doctor says, well, we possibly could give you some medicine, but that's not a cure all, maybe it won't work at all. So, from that standpoint, these are good doctors. I'm pleased with the performance in the past, so I had no other course of action but to listen to them and kind of depressed when there's nothing you can do about something that's affecting you. It's not like high blood pressure. You have it, but you can't feel anything. Well, with this, you can really feel it, and it really, really changes your life.
So let me ask you a real pointed question here. For the years that you were getting treatment from your traditional medicine versus the 3 weeks you've been with us so far, what would you say has helped your life and your quality of life better?
There is hands down my feeling is that this organization has changed the progression of the problem that I have, and the other standard medicine, I can't, like I said, I had positive aspects with normal medicine, but they just couldn't address, or they don't know enough about this particular issue to have a chart a course of action. So I'm glad that the internet is out there. I'm glad I did my research. Like I said, I was a skeptic. I thought it was just a pie in the sky idea, but it works. That's what counts. It shows positive results. I didn't think it would be this quick, but it's working.
And you know what? We don't blame the traditional doctor, and for the most part, it's not their fault. They're in this healthcare system machine themselves, so they've gotten cut reimbursement, like I mentioned to you, and increased paperwork, and they just don't have time to really dig deep past things that aren't like.
Yeah, but see, it goes down to the root cause, to me, of the medical profession. In medical school, they're not taught holistic type of medicine. It's just traditional, not state of the art, but traditional boilerplate type of information. And like you said, it's controlled by how you get paid. If you don't do something, you don't get paid. So some of the doctors, I think, maybe the younger doctors, which I haven't experienced, are learning this in medical school. But the older traditional doctors, I don't think they have the knowledge of what is out there today.
Yeah, but the one thing that's true is that we all want to help our patients. We just have different toolkits that we use. So I'm glad you're getting results, Pete.
Yeah, so am I. And again, it's nothing against. I had instances where I had been treated by the traditional doctor. Traditional meaning, the doctors that we all see, we all know about, and had excellent results. Nothing but the highest regards for that profession and the doctors that I did see. But they just didn't know enough about this particular issue with they knew it came from diabetes, but they didn't know how to treat it. Well, yeah, you can take your medicine for diabetes, but it doesn't work on solving the issue with the problem with the feet. So this organization, Align, is working magic as far as I'm concerned.
We appreciate that, and more will be revealed, and we'll catch up with you again.
Yep.
Take care.
And this is not costing you anything. I'm not charging you for this interview.
Thanks, Pete. Bye.